Welcome to another episode of Muslims and Mental Health. Today we will be discussing what is ADHD, or Attention Deficit Hyperactivity Disorder. I am joined today by Dr. Joshua Wyner. Please help me in welcoming Dr. Wyner to our set. Dr. Josh is a clinical neuroscientist, marriage and family therapist, and a licensed professional clinical counselor. He uses his unique understanding of the relationship between the mind, body, and heart to help clients become more mindful of their thoughts and emotions. He began his career as an engineer working at USC's Optical Material and Devices Laboratory, where he developed retinal prosthetics to restore vision to the blind. However, he quickly discovered that his real interest was in human aspects of helping people see, not building the devices themselves. He soon transitioned to USC's Neuroscience and Marriage and Family Therapy programs, where he studied with Dr. Laura Baker at the USC Twin Project. There he worked with twins to discover how environment and genetics help shape who we become. He is currently the department chair of the Chicago School of Professional Psychology's doctoral MFT program and maintains a private practice in Studio City. Thank you for joining us today.
Thank you for having me.
So I want to start by asking you, what is ADHD?
So I love that question because it's really loaded. So I'm going to, if you'll indulge me for just a minute or two, to go back first and talk about decision making. So to understand ADHD, we have to understand how do you go about your day making the choices that you do. And there's a philosophical piece here a little bit, but the short version is when you go out and you're taking a drive, so you leave here tonight and you get in your car and you get on that 101 highway and there's no cars. And you have this idea that maybe you're going to drive a little fast today. You know, maybe I'm going to do 90 or 100 because no one's looking, right? And you say, well, why would that even come to mind? And fundamentally, first, there's an emotional component. There's something about going 100 miles an hour on that freeway that might be fun or expedient, right? I'm going to get home faster because I'm tired. Or it's exhilarating, you know, maybe the idea that maybe I'll get caught, you know, that entices me. But then you check it. You say, maybe that's a bad idea. The last time that happened, I got a ticket, or I almost hit somebody, or maybe I did get in a car accident. And so maybe you don't. And so you weigh these choices. But in order to weigh them, you have to have the emotional piece first. Because otherwise, the idea never comes to mind in the first place. So for example, you'll notice, at no point in that example did you probably think, maybe I will fly my car away. It didn't even occur to you as a possibility because that's just not in the realm of the potential choices for you.
Right.
So then when we come back to what is ADHD, ADHD from a neurological perspective and a behavioral perspective becomes an emotional problem of not being able to connect the emotional salience, what Damasio would call the somatic marker, to your individual experiences in the first place. And so the result is a whole bunch of symptoms, some of which are attention problems or hyperactivity, but those are just expressions of what I just described. So that's really seemingly the answer to what is ADHD. And that's why I have to go back, because you'll notice at no point in that description do the words attention or hyperactivity actually show up.
Right.
Because they're not actually relevant. So that's my answer.
And so are there different types? So I know some of our audience is familiar when there was, you know, ADD, ADHD, like how has that changed in our present?
So I would say that my understanding is ADD was simply an older term. I don't know anyone in the psychology community that still uses it. ADHD was adopted to encompass this other piece that we started to notice, the hyperactivity. In terms of the types, the better way to describe it, I think, is that it's a spectrum disorder, where everybody has a different level of somatic or emotional connection to their environment, to their world. And that can be very strong. In the very severe case, I would say that's actually OCD. That's the over version. And then the under version is ADHD. And there are different levels of that. And diagnostically, there are different types, right? So if I open my DSM, you will see, predominantly hyperactive type or predominantly inattentive type. But at a core level, it's not a different disorder. It's a different expression of that emotional tagging difficulty.
And so for our general public audience, those different types are more like adjectives, right? It's like just modifying things slightly to understand things more clearly, but it's not really different.
So if I give you an example, is I always liken ADHD to color blindness. So here I have a demo. Can I show you a demo? Right?
Oh.
There we go. When I have slides, I can do this on the computer, right? But I say, I'm going to put down some red balls, and I'm going to put down one that's a little bit pink. And I want you to point to the pink ball, right?
Okay.
But now I give you ADHD, and I say, all right, please isolate the pink ball. Which one?
Is this
You're
a
not
trick
even
question?
It might be. Right? So you,
well, I guess pink is a derivative of red, but I don't see a pink
But you
ball.
don't see which one's different, do you?
No.
Yeah, this is the experience of the severe ADHD individual. Everyone else in the room, though, sees the pink ball, and they think you're crazy.
Okay.
Right? So now, because the pink ball is the equivalent of pay attention to the teacher. So now I say, look, the pink ball is this one. It's right here. Right? So now you come into school the next day, and I say, pay attention to class, which is the equivalent of pick out the pink ball, and you say, okay, and what do? You probably reach for this one, and you're correct this time. But now we have a new teacher, a new experience, and then I put the balls back out again, and I say, pick the pink ball out. Now you're confused.
Yeah.
So depending on how you deal with that, that's the expression. So if I say, all right, it's this one. No, okay, well, no, maybe it's this one. No, maybe it's this one. You call me hyperactive. You say pick the pink ball, and I do what you just did. Oh, now you're inattentive, right? Or maybe I just say, all right, I'm going to just do this. I'm just going to throw it. You say, okay, well, you're hyperactive. Right? Well, I'm not really hyperactive in this case. I'm just, or I'm not risk-taking, or I'm not doing any of those things you describe with ADHD. I'm just doing the best I can because your instruction doesn't actually make sense to me.
Which actually sounds more like an indication of a more advanced thinker or somebody who's thinking outside the box.
Well, you'll often see ADHD individuals, especially smart ones, able to compensate because they find tricks to deal with the reality that they're not making these normal connections emotionally. And so in those cases, you often even get it undetected until adulthood. And then they get diagnosed with adult ADHD, but when you do their history, you find it's really just they were able to deal with it in school. Because school is nice for ADHD. It's structured. It has clear instructions that do not require me to identify what's important because my teacher will tell me. I just have to do the assignment. Right? So it doesn't show up often until, say, graduate school. Write a dissertation. Oh. How do I do that? Well, now I have no clue what I'm doing because there's no direction anymore. There's no scaffolding around me.
So what are some of the causes of ADHD?
The primary cause does seem to be biological. The genetic variance, when we look at twin studies, is usually up there between 70 and 80%. And for those who look at twin studies, that's a number that's on par with things like height. Right? And we all agree height is pretty biological. It doesn't mean there's no environmental piece, but that's pretty high to say it's just how I was raised. I think some studies estimate that there's about a 50% chance that someone with ADHD has an ADHD parent, for example. So numbers like that tell us biology plays a key role. And in particular, there's this one area of the brain, it's called the anterior cingulate. That's not important for those who are listening who don't have anything to do with neuroscience, but the piece that's important is that's precisely the part of the brain that helps us integrate emotional experience and what's happening right now. So that you, for example, if we take the car example again, you're about to get in a car accident, you get terrified.
Yeah.
One of the benefits of getting terrified is you react quickly and then you remember. 10 years from now, you're driving down that same road and something similar happens, that memory is triggered because of that terror you felt. Because you tag this as, this is an important event for me to remember for the rest of my life because this will keep me alive. The ADHD person doesn't do that, or they don't do it as strongly. And so they don't remember things on that visceral, emotional level. And so they don't come back in the scenarios when they need them. And so what it looks like is they have trouble learning because on that really fundamental front, they do have trouble learning.
Is it an altogether new experience, or is it just not the same effect?
I think for most people the reality is that it's just a little bit muted or different because I use the very extreme version when I explain it just because it's more clear. Most people are much further along on the spectrum towards the middle where they're a little bit impaired. So the most common thing you'll see, and the reason I bring up the driving, by the way, is it's one of the best examples for ADHD, because ADHD people are statistically far more likely to get in car accidents. And the reason seems to be exactly what we're talking about, where you'll hear reports from them. Well, they'll say, I wrecked another car. What happened? Well, I was driving. I had one person on the 101 at night, going a little too fast, and there was an overturned car in the fast lane and the lights were out, right? So in one sense, not their fault, but in another sense, this is like the 5th car they've wrecked, and another person would have started to feel panic when they were going, let's say, 85 at night and it was that dark, and they would have slowed down. The ADHD person is looking up at that car, and they're thinking, there's a car in front of me. Maybe I should wham. Whereas you just slam on the brakes, you're done. So that's what, it's kind of a new experience, but not entirely for most.
So I want to ask you about the symptoms, but what you just mentioned actually brought up a question for me around the symptoms, because what you talked about just now with the car, I think is also something we could see in somebody who has trauma, right? Who has mirror symptoms of ADHD. Do you ever find that it's difficult to parse out whether it's trauma or ADHD that they actually have?
You know, I don't know that it's too difficult, only because with trauma, it's typically context specific. Right?
I mean, the reason I asked that, I mean, I know that sounds like an obvious answer, and when we're talking as two professionals to one another, but there were a lot of kids that were misdiagnosed to have ADHD who actually just had trauma. Not just had trauma, but they had trauma.
I would believe that, and I think there's a lot of misdiagnosis out there, and the main reason is because of this name. So if you talk to, what I'm talking about is fundamentally Russell Barkley's model of ADHD, and I focus on his because it's the only model based in real research. And when I say real research, I mean decades and decades of twin studies on ADHD and nothing but ADHD. And so when Barkley says, this is what I found and how it works, I trust him. Oh, and because it makes sense, it's a parsimonious explanation that fits all the pieces together. The model that's in our DSM is frankly terrible. It focuses on the symptomology. And one of my favorite quotes from Russell Barkley, because it really hits home, is sometimes if you listen to him speak, he'll say, calling this disorder ADHD is like calling autism hand-slapping disorder. How insulting would that be, right?
Right.
That's a possible but not necessary symptom of the underlying disorder. So he would call it temporal myopia, which just means, you know, nearsightedness in time, meaning if you look at that emotional piece, in the moment I'm okay as I'm driving, But because I don't connect as strongly on that emotional front, over time my connection with meaning and value and what I should do disappears very quickly. And it's often, we use experiments like the marshmallow experiment you've probably heard of. I'll give you 1 marshmallow now, or I'll let you have 2 in half an hour from now. Which one do you take? And with adults, you can do it with money. I'll give you $1 now.
Right.
I'll give you $10 next week, or 20 next week, and you can kind of come up with a time frame and an amount for each person. You know, and the ADHD person is much more in the moment instead of in the future and past.
Which has its advantages sometimes in life.
It can, especially for certain jobs are actually very ADHD sort of attractor jobs, like fireman, insurance adjuster, photographer is a very common one I see with clients. And it makes sense because the whole job is now.
Yeah.
Shoot the wedding, done.
I really, really appreciate this perspective on ADHD. I had not, to be honest with you, it's not a large part of my caseload, so I haven't had a lot of experience treating ADHD. Right. And this perspective is really illuminating, and it's, I mean, it's a whole new way of relating to the disorder that I think makes a lot more sense.
And I think so. That's why I was really attracted to it many years ago, back when I was still an intern.
But just to say, so let's put the symptomology aside for a minute. What are signs or signals that a parent or community member or family member should be looking for in someone who may be exhibiting what looks like ADHD to get them help or to get them assistance? Well,
so first I would say it is focusing on that sense of the time and the emotional piece. And one way I often describe it to people is I say, similar to personality disorders, it's one of those disorders that is also developmental, so that a 2-year-old, I sometimes will say, is ADHD. They have to be because they only exist in the moment. There is no past experience yet. They're 2.
Right.
Personality disorder, same way, right? It's something where it's a disorder precisely because when they get older, they're still doing the same as if they were 2. So one way to think about it is like that, and for parents I think it's helpful because parents will often freak out when they see those symptoms at, say, age 2 or 3. And I say, look, at 2 or 3, don't worry about it. Worry about it if they're not learning from their mistakes. Worry about it if they don't seem to be even aware. You know, worry about it if you have, I love the classic ADHD interaction. Clean your room. Okay. 20 minutes later, did you clean your room? Yes. You walk by, room is completely filthy. Right?
Yes.
And you say, well, what happened just there? Well, from this model, what we see is in the moment when the question was asked, the only thing that was emotionally relevant was not whether or not my answer is truthful, it was which answer will be the least uncomfortable in the moment. And in the moment, the most comfortable answer is yes, because I know if I say the word no, I'm going to get in a fight with mom right now.
Right.
No connection to what's going to happen in 30 minutes when mom figures out I lied and all of that. It's not even, it doesn't even come to mind. Right? And that's often in ADHD, they say, for example, ADHD people lie. Well, kind of.
To cope, right?
But it's like what I just described. It's not, it's a lack of truthfulness, but it's reflexive. There was not intent to deceive. There was simply a use of my mouth to make the sounds necessary to avoid discomfort right now.
I wondered if you could speak to how this shows up in different environments, and also how not just the family but the community can be supportive of somebody who has it.
Well, first, one of the keys, and it kind of goes back to your earlier question about trauma versus ADHD, is this will be pervasive because it's a way of being in the world where the emotional piece, that tag, is smaller than. So you'll see it at home, you'll see it at school. You might see it less at school sometimes, depending on the person, but you'll see it in all these different areas in different ways, and the common thread will be that lack of emotional connection.
So it really should show up in all these different environments. If it doesn't, then you're maybe looking at something else.
If it's really only showing up in one specific context, then yes, the argument would be that's unlikely to be ADHD. The one caveat is, and it also answers your other part of your question, is that the solution or the way to help treat on a behavior level, in addition, of course, to all the medications that are very important in this particular situation, is to create external scaffolding. It's to recognize that I, the ADHD person, have a deficit in being able to connect emotionally and remember these different experiences, and so I need external help to augment that. The same way that if your leg didn't work properly, you might need a cane or crutches or some other scaffolding. You wouldn't expect the person with leg damage to just get up and walk right away. They have to do the training, they need the extra help.
So taking a specific example, like with the room that you mentioned and it not being clean, what would external scaffolding look like?
Mom actually goes into the room and says, now it is time to clean your room. Right? I need you to get off of your computer and your video games now. We will clean the room together. You will pick the things up, and as you do it, I will, as mom, I encourage you. Good job, thank you. Oh, great work putting that there, that's where it goes. You're doing it in the moment because that's where that ADHD person lives, remember? In the moment?
Right.
So we have to be in the moment with them. Instead of the classic response is the person outside gets frustrated and then they say, well, they'll learn from their mistakes. No, they won't. They will never learn from their mistakes unless they're provided with the additional scaffold.
And so once I gave a talk within the Muslim community on the symptomology. One of the things that we talked about in that talk was how exhausting it can be for a family who has a child who has ADHD. In addition to the fact that of what you pointed out about the genetic component, maybe one of the parents also has it, and so you've got, not just the exhaustion of the parents because of the child, but their own issues, right? And one of the traditions within the Muslim community is that you're supposed to know what your brother or sister needs before they ask for it. So one of the pieces that I asked the community at that time was to get to know families better so that you can offer to babysit maybe for an hour or two so the parents can recoup, from that exhaustion. Along that line, is there anything else you might recommend that would be helpful from the community level to help families that have a child who has ADHD?
Honestly, often understanding is core. I would say that's first. When it comes to the lying, that's a great example. When you say someone lies, there's a connotation there in addition to the denotation about an untruth, that there was willful deceit with the attempt to in some way do something mean. That it's deceit. It's not just a lie.
Right. Manipulate.
It's manipulative. It's mean, and people get angry and frustrated with it. If you understand it's not, and I often like the word inveracity when we talk about ADHD, to distinguish from lies. So was this inveracity or lying? And I ask each time that something untrue comes up, and I distinguish them. Right? So that would be one thing, because that really helps both the ADHD person and their family. The other piece that I love, when I lecture on this, I often have this video that I show out of, I believe it was Rochester, where they redid the marshmallow experiment.
Okay.
Right? But they redid it by adding a component where before they asked about the marshmallow, they gave the kids some crayons. But in one scenario, they promised them crayons and then came back and apologized because they couldn't find the big box of crayons. And in the other scenario, of course, they got the big box of crayons. Then they did the marshmallow experiment. And what they found was the kids that were in the reliable condition, where the person did bring the giant box of crayons, would wait something like 5 times longer for the second marshmallow than the first group. Right? So what that tells us is that idea of the marshmallow experiment is not entirely innate in terms of whether or not I can wait and see the future. It depends on the reliability of the environment I'm in. So if I have a social environment, family and extended family and community, that is consistently reliable, I'm far more likely to be able to do this kind of work than if I don't.
Like the teacher at school and maybe even the religious leader at the mosque. I mean, the more participatory, the better in terms of community.
Right, especially in the context of that scaffolding, because that word scaffolding I know is vague. So we say, what does that actually look like? It often looks like someone outside the person providing additional, ideally relevant, but additional reward and encouragement and positive reinforcement, from our ABA friends, to each and every activity that the person does successfully. So that in addition to the natural rewards that they're not able to connect with on an emotional level, they get another one now. So with young kids, we use stone jars as a great example. If that stone jar is reliably used, then it works. But if only one person's using it and then someone else like in the community says, well, I'll tell your mom you'll get some stones when you get home, and then she doesn't do it, now school is no longer reliable and we're not helping the kid anymore.
Because somebody might actually need to remind mom to do it if she's the one that has also ADHD.
Yeah, I like to call that the perfect storm,
Yeah.
because the worst possible parenting style that you can give a child with potential ADHD is an ADHD parent.
Yeah. But it's likely that will be the case.
Exactly.
Yeah. Wow. Well, actually, our time has flown by, and we are near the end of it. And I wanted to, first of all, thank you so much for this perspective. It's really certainly been enlightening for me, and I'm sure it will be for our audience as well. We don't like to let our guests leave, though, without asking them a few fun questions. And so I'd like to ask you a few before you leave. The first of which is, who is your hero and why?
That would be Louis Pasteur. And the why is very simple. Since I was a kid, the story, whether it was real or not, I have no idea, because these people become larger than life, is simply that he stood up to an entire scientific community that told him he was completely nuts and wrong. And he said, I don't care. The information in front of me tells me I'm right, even though everyone else says I'm not. And in this case, he was right, and now we know his name.
So I'm seeing a consistent pattern here. You start out with the work around seeing, and then you help people see through your work now in a different way. And you choose a hero who also helped people see that, in a different way.
Yeah, and stood up to the status quo, which I think is so important, just socially.
Have a nice continuation there.
I try.
Yeah. So what is your favorite word and why?
My favorite word is actually to grok.
What is that?
To grok. G-R-O-K.
What does that mean?
To grok, it's a word that Robert Heinlein put into his Stranger in a Strange Land book, many decades ago. And the reason that word is, it's always my favorite word anytime anyone asks, because it means to understand something wholly and completely on an emotional, spiritual, and intellectual level.
Oh, wow.
It means
That's a nice
to,
word.
yeah. And there really is no other word in English, which is, I think, why he had to invent it for the book. And it's my favorite word, one, because it's just a great word, and two, because to me it is really just a synonym for therapy. Right? Yeah. That's our job. Our job is to help people grok. Yeah, I love that word.
And so, backing up one question, what was your favorite concept and why?
To grok.
Fair enough. Okay, well, thank you so much for coming on the show
thank you.
And helping our community understand this issue much more clearly. It is something I know that our community has a great interest in. A lot of families are dealing with children that have ADHD or at least what's been diagnosed as ADHD, which, now maybe even if there's some differential issue, they'll take a look at that as well, given a better understanding. Thank you for joining us today. If you'd like more information about Dr. Joshua Wyner's work, you can go to joshuawyner.com and find out more about him and even connect with him if you'd like to make an appointment. This concludes another episode of Muslims and Mental Health. We're so happy you could join us. You can find more information about the work that we are doing at our adjunctive website at nafshealertherapy.wordpress.com for tools and sheets and work and so forth. Or you can find more information at the Center for Muslim Mental Health. That's CTR for Center, the number 4, Muslim Mental Health, centerformuslimmentalhealth.com. And we look forward to seeing you in our next episode. Assalamu alaikum wa rahmatullahi wa barakatuh.